So
welcome back to AM Northwest. Problems with your dental health can impact the rest of your body. And those silver fillings you got when you were younger may be to blame. Here to tell us more, we welcome back from Sleep Dentistry Defined, Dr. Heath Lampee. Always good to see you, Doctor.
Thank you so much, Helen.
So you say you have patients who come in and they're a little bit concerned about the old fillings they have.
I have a lot of patients come in, yes. They haven't been to the dentist in 5, 10, 20, 30 years. And a lot of them have mouths full of old silver fillings from when they were like 10, 12, 20, when kids get a lot of tooth decay.
Right.
And back in the day, the only way to fix that tooth decay was Mercury silver fillings. We didn't have the new composite white resin fillings that we do now. I personally haven't even put in a silver filling in 10 years.
Oh, wow.
Yeah.
So are they worried about their health issues? Are they worried that there's mercury going into their system? I mean, what are they concerned about?
I do have some patients that worry that some of the mercury ions from the silver fillings are getting into their system. Now, mercury that is inhaled, like from chemical plants, is the real bad culprit because it goes straight from the nose into the lungs. That's the worst mercury.
Gotcha.
Mercury that we get like from eating fish, stuff like that, most of that passes through our digestive system without absorbing. So there is a chance small amounts of mercury could be getting into a person's bloodstream through their fillings. You know, over 100, 200 years ago, they used to use mercury as cures for different ailments, and they didn't realize that they were actually poisoning their patients.
Oh, wow.
It's really interesting.
So can you tell when someone's suffering a health issue and you find out that the silver has been decaying, that could be the root of the problem?
So when a patient comes in, I get photographs of their mouth, and we look at them together, and I have this big macro lens so I can see the tooth really up close. And I can see, is the mercury filling, is it cracking the tooth? Is it also causing the enamel to go black or dark? Normal tooth enamel is white. It's beautiful. But a silver filling that is leaking and getting bacteria underneath it will be black or white all the way around it. So if I see a crack or a black or white enamel around a silver filling, I know that there's bacteria under there.
Right.
And these bacteria that get underneath these silver fillings, they're nasty little buggers. They don't even need oxygen to survive. They're called anaerobes. And so these bacteria are nasty. So if I see that, those dark fillings, cracks, I will say, hey, we need to take this silver filling out and figure out what's going on underneath this and get this out. And if you've got a whole mouth like this and we switch them all out, you can imagine you're going to feel different.
Take a look at this. This is the before, and then tell me.
So this patient, so on his lower left side, the right-hand side of the screen, he lost a couple teeth because of really big silver fillings that broke the tooth. They were too the cracks were too big, they were fractured too bad, so they had to come out. But the rest of his mouth, there's 2 silver fillings on the other side, there's a silver filling on the other side. We had to basically do new fillings and crowns in here and give him dental implants to restore him, to make it so it was like, you know, that he's whole again.
And he's got to feel better.
Oh yeah, not only is his smile better, but all those cavities, those bacteria and the silver fillings, they're out of there.
Right.
Yeah.
And it looks so much better.
Oh my gosh, yeah.
Yeah, I mean, when he smiles or speaks even.
He smiles, he speaks, he chews. He knows that it was worth it, that he is a different person in a way. He's the way he's supposed to be.
So is the new material that you use now, does it stay in better? Does it?
It actually does stay in better. I've worked many, many years on figuring out how to really bond these new fillings and crowns in this so they're as strong as possible. They're much stronger than those old fillings that people have. Now, the one thing I always caution patients is that with the new porcelain crowns that we put in, new composite fillings, you need to take care of your mouth. Stay away from really hard food. Stay away from really sticky food. Don't abuse your mouth, because if you eat really hard and sticky foods, you can break your natural teeth.
Right. Don't want to do that. All right, Dr. Lampee, you want to tell folks to check out Sleep Dentistry Defined, 503-646-2273. We'll put the information on our website at katu.com. Thank you very much.
Thank you.